Okay, ready?
I think we're ready, yes.
Yeah.
Cool. I'm going live.
Welcome, everyone. You have tuned in to Parents Learning with Parents Learning Through Parents, a free speaking series, navigating white-centered services and systems as a BIPOC parent and caregiver for BIPOC parents and caregivers. What does BIPOC mean? BIPOC is an acronym for Black, Indigenous, and People of Color. My name is Victor Bradley, and I am glad you're here with us. We are the Bright Family Engagement Team. We work with families all across the New England area and facilitate peer-to-peer support groups, providing resources and help school clinics engage families in their work. BRIGHT stands for Bridge for Resilience Youth in Transition and is an organization out of Brookline Center for Mental Health in Brookline, Massachusetts. BRIGHT helps schools build and maintain high-quality Tier 3 general educational support programs for students struggling with mental health and medical issues. There are over 150 BRIGHT programs in elementary, middle, and high school in Massachusetts, and several other programs launching in New York, New Hampshire, Oregon, and Illinois, and more across the country. So now I'd like to have Lakeisha introduce herself as part of the BRIGHT Family Engagement Team.
Good evening, everybody. My name is Lakeisha Edwards Wilson, and I am a social worker here in Atlanta, Georgia, at the Children's Healthcare of Atlanta. I work in an outpatient clinic and to serve families who need resources while they're in the hospital or outside of the hospital. I'm there to assist them. So welcome, families.
Thank you, Lakeisha. My name is Victor. As I said before, I was an early child educator for 30 years. Now I do anti-racist, anti-bias work. I do consulting. I do family work. I work with children and schools and districts. And I really enjoy this work. And I also work for BRIGHT now, and I really enjoy that as well. I would like to now do a little bio of our presenter right now. Or you can do it, Lakeisha, too. I'm doing all the talking.
Absolutely. So tonight's presenter is Jaleesa Williams. She's an LCSW, fierce therapist, educator, curator who has worked to create intentional spaces and conversations regarding self-care, diversity, and liberation. Within both roles as an educator and therapist, Jaleesa enjoys the ability to help others grow within themselves and their understanding of the world. As a college professor, she challenges conventional ways of teaching by engaging students in experiences that shift their perspectives and understanding of their own social positioning. Based in Denver, she has worked at MSW Denver, Regis University, and the University of Denver, teaching courses surrounding identity, power, systematic oppression, and creative lens to engage in change. Her current research interests lie in transformational justice and accountability, mindfulness, and embodiment, racial trauma, and healing. And racial, oh my goodness, I can't pronounce this one. Correct me, pedagogies? Oh my God, I'm sorry. She's currently a mindfulness educator and therapist working with Black and other folks of color, ready to put intentional and action together to make magic. Find her on Instagram at Soulflower Experiences to keep yourself up to date on events she has manifested into fruition, or email at sunflower.jw@gmail.com for booking inquiries. And I just want to introduce Jaleesa Williams tonight. Jaleesa, the floor is yours.
Awesome. I appreciate y'all. Thank you so much. Peace, everyone. My name is Jaleesa Williams. And tonight, I don't know what zip code y'all are in, or even what time you're watching this, honestly and truly, but we will be diving into some conversation around how we are navigating white-centered services and systems as a BIPOC parent or caregiver. If you could go ahead and share the screen. We'll get into it. All right, next slide. Okay, so an overview for the evening. We are going to start off with the grounding. I am a yoga instructor, and I'm also nervous before I do anything. So I think before we are able to really get into certain conversations, we need to get into our bodies. So we'll do a little bit of breath work just to kind of get here before we start talking about the things. I'll introduce myself. I like to create some space so y'all know why you should listen to me, why for what. We'll go over the history of BIPOC caregiving, also the BIPOC experience with care, and I will end off with talking about how to take care of yourself since you are navigating all of these systems. Next slide, please. Okay, let's get into our breath, get into our body. So I'm really big on challenge by choice. This just allows us, especially as BIPOC folk, we navigate through the world with a lot of trauma just settling in our bodies. And so how we tend to see that settle is it's in our joints, right? It's set up in our joints as like cortisol and stress. And so before we are able to really engage in some intentional conversation, I'd love for us to just take some breaths to kind of settle ourselves to be here and be focused. I also think y'all are grown, so do what you want, right? So if this is already recorded, just fast forward. If you don't feel like it, go ahead and grab some tea. It's going to be a few minutes, but if you are here, I would love to give you a moment to rest. So if this does feel calling for you, I encourage you to get yourself in a comfortable seated position. Whether that be in a chair, on your bed. I also want you to take up some space. Us as folks of color, we are taught to be smaller than we should be. And so when we are breathing, I definitely want you to be as big as you can dream. Take a moment to perhaps look around you to make sure you feel good and safe. And if things feel good and safe, I encourage you to go ahead and downcast those eyes or close those eyes. And I just want you to breathe. You don't have to change that breath. I just want you to breathe it, listen to it, and be here with it. On that next exhale, go ahead and let everything out of the lungs. You're going to inhale through the nose and just fill up that low belly. Maybe put your hands there and hold for 4, 3, 2, 1. Exhale out of the mouth. If you can make some noise while you're doing this, I encourage you to do it too. Inhale through the nose, fill up that belly. Bring that breath up into the rib cage, filling up those nooks, those crannies, and hold here for 4, 3, 2, 1. Exhale, let it go. Inhale through the nose, fill up the belly, the chest, rib cage, good. And then bring it up into that chest, heart space. Hold here, feeling full, feeling a little taller. 2, 1, release. Inhale, fill up the belly, rib cage, chest, and bring it up into the neck, into the head, maybe getting a little taller, feeling full and holding here for 4, 3, 2, 1. Exhale, let it go. Next inhale, fill it up all the way to the top. Close the mouth. Exhale through the nose. And one more full breath. Good. Let your breath be. So catch it to let it catch up to however fast or slow it has to be. And just know that for this next, 35, 40 minutes, this conversation's all for you and your greater good. So be open, take notes, and take care of yourself. If your eyes are still closed, go ahead and just bring that chin to your chest nice and slow. Just take one last good for just being here. And then open your eyes up nice and easy. And welcome back. Okay, beautiful. Let's go ahead and get into it. Of course, thank you. Next slide, please. Okay, so we're going to start off with a little introduction. So my name is Jaleesa Williams, and I am a social worker and also a clinical social worker. And so I graduated with my MSW in 2016, I feel like. That feels good. That was good. And when I was in school, this was actually, when I started graduate school, this was the first year Black Lives Matter started. So this was also when Mike Brown was murdered in Ferguson, Missouri. I was one of the youngest people in my cohort and also one of the only Black women in my cohort. And so it was interesting to navigate what is social work, while also looking at the things happen on social media, while also looking at these books that are so aged. I'm talking about, there was a book that told me African-American clients speak Ebonics. And I was like, oh my goodness, this is what we're teaching the people, right? So understanding how that isn't even that far from here in this moment. So yes, I am a clinical social worker. I got my licensure in 2019, and I started a small clinical practice called Yemaya Energy Therapeutics. My focus is for folks of color. So I, like my tagline, if I had a tagline, it would just be, I want my people to breathe and I want my people to heal. And so when I started this in 2018, I had just threw my picture on Psychology Today, and we know some of the thoughts, rumors, feels about therapy in certain communities of color, especially the Black community. And so it was so surprising to have a full docket of Black and Brown and Indigenous bodies in my emails requesting time and space. I used to say that I focused on like anxiety and depression and all of those things, but as I do more of my work and how it's more integrated into my professional work as a faculty member at Smith College, I really consider myself just doing work for folks that are dealing with white supremacy on a daily basis. And so we'll talk a little bit about what that means. I would consider myself a liberative healing scholar at Smith College School for Social Work. So I am a resident faculty at Smith College School for Social Work in Northampton, Massachusetts, this little tiny baby town that is all white. Yep. And then there's me and a few of us there. Right. So when I am navigating this conversation, I do come off the reality of I am experiencing white systems as well. And what does that look like to recognize those and also move through those? dismantle those, right? I do a lot of work around mindfulness, a lot of work around racial healing, accountability, equity. I'm really getting into radical imagination, and rest is one of my like tenets to that. I'm a yoga instructor. So I've been doing yoga since I was 13 years old. I had shingles at 13. And if y'all don't know what shingles are, they're like stress-induced chickenpox. And so, when I was young, I thought it was because I was like trying to be on the basketball team and I was, in middle school doing work. But I learned later on that I'm confident those shingles and that stress came from intergenerational trauma. So it comes from stuff my mother didn't deal with. It comes from stuff my grandmother didn't deal with, and down the line, because of how epigenetics works. And so when we as folks of color really look at history, we have not gotten opportunities to heal and let go of things. And when those things are not let go of and released through our body in movement, in breath work, in therapy, in crying, in dancing, in being in the earth and being in the sun, right? And when we don't remove these traumas, we pass them down in our DNA to our next. And so I really think that my body was holding on to a lot of the things of my ancestors. And so it was my responsibility to move that. And so I started yoga, and I started a Black Girl Magic yoga class out here in Denver, Colorado at this Black owned studio. And it was just amazing. I would pack it out like every week. It was a cheap class. It was R&B and jazz music, and it just felt good. And it was my way of bringing some of the work that I did in graduate school around yoga and community connection into this reality of, I know what yoga and how good yoga is for traumatic and traumatized bodies. Why are we doing it? Why is it only my Black self in this class of all elder white women? This makes no sense. And it's due to the fact of like how white supremacy came in, how capitalism came in and really shifted the teachings and the learnings and the intention around yoga. And so it's been really fun to play around with that in the community. I have some really great folks that I've connected with. I'm also coming to you all with this life experience. And so I was the medical power of attorney for my mother. Her name was Ema Adua Walker, and she passed away in 2012 of lupus. And when I was her power of attorney, I was 18 years old. I had just graduated high school. She wasn't sick in any means prior to everything happening. And it was a whirlwind of like trying to understand medical records and what are they saying, and do I sign off, and who should I talk to her parents? And it was so much that happened. And I bring her into this space as I do this work every day. And so yes. Let's go ahead and go to that next slide. So we're gonna start off with I'm a teacher, y'all. So I'm gonna teach. This is what's about to happen. Professor Jaleesa is about to tap in, okay? So we're gonna talk about the history of BIPOC caregiving. So when we think about caregiving, we have to start with some of the roots, right? So the history of a lot of BIPOC folk have been caring for white families forever. And what does that then look like? Right. And so I know there is a recent study that says this is only the second or third generation of white women that are actually caring for their children, because generations prior to that have had Black women, brown women in their homes taking care of their children. And then those Black and brown women are then going home to take care of their own. And so understanding there's this interesting link and interesting privilege that can be talked about in regards to who gets what kind of care. All right. With that, there's a cultural responsibility. So a lot of communities of color take care of their sick, take care of their parents, take care of their people, because that's just what we do. Like it's interesting working at such a it's in higher ed, because sometimes I think we try to intellectualize so many things that just is, right? There's a cultural responsibility that a lot of us tend to move through, and this is just what we do. I was 18 years old and I was starting college. My younger sister was starting high school. Did you think that I was even kind of sort of like, oh my goodness, let me get my mother in a home or let me find someone? No, I was just like, oh yeah, I'll do it. Yeah, I'll take care of her. I'll take care of my sister. I'll take care of myself in school. I'll do all these things, right? And that plays into some other conversations we'll have a little bit later around what being strong is. But we in BIPOC communities have a cultural responsibility to take care of our people. And that's different in a white-centered space in which we're kind of expecting others to take care of them, right? Also, the history of a lot of BIPOC communities are coming from lower socioeconomic status. And so that already limits our ability to have access to certain things. Cost of services, are you joking? Understanding insurance, what? And so really understanding, what does that look like? So with or without an insurance, we're still paying so much money. Where is that money coming from? Who has savings? Who had a decent job, that had a decent 401k to kind of even have a little bit of that? And also thinking about that generational wealth. Who has had enough stability to be able to create more stability for further generations? This is also has limited our access to medical knowledge. I didn't know anything about insurance. Why would I know that? It wasn't a thing we talked about. I didn't understand anything about life insurance. I didn't recognize what a 401, I didn't recognize any of those things. I didn't understand those words. I was learning on the spot. So I'm sure I made some like bad decisions, quote unquote, because I just had a lack of knowledge. Or I'm sure I didn't ask the right questions because I had a lack of knowledge. There's a lack of care for medical settings historically for BIPOC communities. So there is a large amount of Black and Latinx Hispanic folk that feel ignored at high rates, as well as reported higher rates of mistreatment in medical settings. So I even simply think about a large conversation we were having in class over the summer where Black women dying in childbirth. Today in 2022 at just regular old hospitals. There's something going on at a lack of care and attention, right? So we're thinking about some of that historical context that has created stereotypes for the medical community to then mistreat us, all right? Next slide, please. We also think about this concept of BIPOC experiences with care, all right? So high risk factors. We have high risk factors, hands down. Systemic racism is a wild risk factor, y'all. Kind of waking up and just like concerning yourself around how you exist is a large risk factor. I give an example of rates of suicide in Indigenous and Native communities are 3.5 times higher than other racial or ethnic groups with the lowest rates of suicide. And that's due to the fact that the government was like, okay, y'all can get some reservations and y'all are good over there. I don't know if you heard about everything that was going on during the pandemic and how many folks were being lost and passing, dying, not getting the attention they needed on reservations. We're also dealing with individual racism. Also during the outbreak, there was 1,500 reported incidences of anti-Asian racism in just 1 month, all right? That's a tiny example of all of the individualized experiences that we are navigating. And then we are also navigating a thing called racial battle fatigue. This is one of my favorite conversations. And it ultimately is a cumulative result of race-related stress responses that look behavioral, psychological, and physiological. And so there is research that says from experiencing racism so much, our bodies are deteriorating. It literally says that our hearts are beating faster. We're having horrible digestion. We're grinding our teeth all the time. We have headaches. We might be drinking more. We might be engaging in other vices just to like numb out things. We might be doing too much at work so that we don't look like one of those people, right? We are navigating a system of whiteness that doesn't allow us to just simply exist in it. We have to perform in it. And performing for so long then creates active behavioral, psychological, and physiological responses, right? So some of that high blood pressure ain't got nothing to do with you eating. It has a lot to do with where you're working, right? And so really understanding what does that really mean as we're moving through the world? Understanding healthcare access. Native and Indigenous reservations have lower healthcare provider to patient ratios than any other community in the United States. What? How does that even make sense? Yet we're all supposed to be navigating this level of equity. We're all supposed to be super comfortable in the medical setting, yet you all have not even set us up to win. Asian Americans tend to not seek professional support services as a lack of cultural relevance. So we're not even getting folks that are speaking native tongues to be able to come in and hold space and explain cultural exchanges, to talk about customs, traditions, talk about what's happening, because we're just assuming that they can just come in here and speak English or they'll find someone to do it for them. Right? That lack of care is how we die. All right. Next slide. We also think about those financial limitations, right? 4 out of 10 caregivers are unemployed to caretake. So a lot of folks have to leave their jobs to take care of the folks in which they are loving on, right? There was this really interesting stat of 154,000 Black women left the workforce during the pandemic to take care of the people at home. That's a lot of work. And that's also a lot of money. There's another statistic that says Black women are some of the women with the highest amount of degrees and making some of the most money in the country. They tend to die with the most debt. Black women have a net worth of negative $40,000 when they pass. Disgusting. And it tends to be because they tend to be the #1 caretaker in their home. So their paycheck isn't just going to them. Their paycheck is going to them, their mother, maybe their uncle needs a little something. You already know they got the kids that they got to take care of. And when we kind of want to put a little something in savings, it's gone. It's gone. Navigating those financial limitations push folks into further debt, hands down. Medical debt is one of the hardest and most difficult ones to navigate out of. It just makes no sense. They're just like, I know you had that kid and I know you needed that one IV, but that's going to be another $1,200 and we need it by next week. It's so wild the ways in which this medical systems work here, right? We also think about how over 40% of Black, Indigenous, and other folks of color, they begin caretaking at younger ages than their white counterparts. So they have far less time to be able to create stability, create wealth, create much of anything before they're just taken care. I think about myself, I started caretaking when I was 17 and a half, 18 years old. We also are thinking about, there are thoughts that folk have about hospitals and therapy, all right? That's real, that is so real. Hospitals, the smell of it makes me nauseous. I'm looking at everybody's side eye. I've read too many articles, I've navigated too many things, and this is true. This comes from the understanding of historical and personal experiences. This isn't like we just made this up and we just have this random fear of doctors. No, I'm thinking of just Henrietta Lacks off top. And like literally the ways in which the medical system has harmed Black bodies in particular. And so it makes sense that you do not want to go to the hospital. And so you just need to put that little ice pack on your back and drink some ginger ale and lay down. I get it. I get it. Right? We also have to recognize the benefits of care when we are accessing the right ones in these spaces, like hospitals and certain therapy spaces. This is a part of our caretaking, right? As well as dentist's office and those little checkups. This is how we live longer. And how do we navigate that without experiencing the heaviness of the systemic racism, right? Without feeling overwhelmed or guilt and shame for not feeling capable and understanding how to do it. I think a lot of us have seen our ancestors do it. They just do it. You never really saw them complain, you saw them get up, you saw them do it every day. That's just how they did it. That is, yes, they did, absolutely. And I'm confident, unfortunately, they passed earlier than they should have. Than our white counterparts that get to access a little more rest, a little bit more ease. Instead of our white counterparts that the system is literally centered around them. So they just have to turn around and close their eyes and pick a button and someone's going to assist them. Versus folks that are starting to navigate outside of this white-centered space are now going to be navigating a whole different level of challenges and obstacles. Next slide, please. So with this only being 40 minutes, I'm just kind of giving y'all a taste of things. But what I really want to overemphasize and encourage you all to lean into more research and Googles and finds for yourself in your own community. But I want to encourage that as you are navigating these systems, just slow down. And I know that sounds so counterintuitive to how life is moving. Yes, correct. And also, when we are in our bodies and slowing it down, we are making the best decision that we can. When I'm just being thrown paperwork and things and people are saying stuff and who's what, it gets who. But you can't control them, but you can control yourself and you can slow down, all right? So whether that be going for walks, turning your phone off for 5 minutes, going into a closet, screaming into a pillow, right? Doing some breath work like we just started. There's a whole bunch of things on TikTok, Twitter, and Instagram, and YouTube that you are able to find that might just feel like a pillar for you to grasp onto when the world is kind of going crazy while you're going through this, because it's going to happen. I don't want to lie and act like it won't. I want to overemphasize making connections. I want to overemphasizing making connections. We cannot take care of ourselves in isolation. It requires community. I know a lot of folks think self-care is just a bubble bath and a little wine and a face mask after a long day. No. It's so much more. It's knowing who your neighbors are. So just in case some things get a little weird one day, they're able to come in and help you, right? It's having their numbers so they can text. Maybe you had a long day, they got some extra food and they want to bring you dinner, right? That is connection. I think about making connections at the medical space. I became BFFs with all the little nurses that were in my mother's room. Because if you know me, you now care for me. And you will then care for my mother, and you will see them as a human and not just this thing, a part of your day. I was over here, I was lying to them. I was like, oh, I want to go to nursing school. What are you doing over there? And they're like, oh my goodness, let me tell you what I'm doing. I'm like, oh my gosh, yeah, I'll be here tomorrow. I can't wait. I was schmoozing them. And that gave me and my mother, I think, a little bit more access. They were telling me things in slow motion versus jargon, right? Like the nurse would come in and be like, okay, so this is what's going to happen. So if you have, what do you think about this? Okay, cool. So when the doctor says this, say that, Make those connections. Become tight with the people in the cafeteria so you get some discounts on those food. The food is expensive at the hospitals. All right. Get your connections where you can. You might get your extra juice box every now and then. It's just like the reality of like, we need connections because this is how we don't feel like we're just doing it by ourselves, because you're not. Even when you are, you're not. I want to overemphasize asking for help. And I think that's something that's really difficult for us, especially as communities of color, because I don't recall a lot of us seeing our family, our parents asking for help. We just saw them do it magically. And, they didn't really tell us about if it was a fumble or if their mother helped them or if this was actually a loan from the bank or if they were crying themselves to sleep last night. They don't tell us those parts. They miss those parts. I want to tell you, asking for help is literally one of the number one things you can do to be able to access better care for not only yourself, but for the people you are loving on. Ask your family, your friends and your family. Ask them for help. And the help can look like, could you grab me some laundry detergent? Hey, when you cook sometime this week, could you make a little extra and put some to the side for me? Hey, people are always like, tell me how I can help. Tell me how I can help. Tell them. Don't be like, oh, it's okay. I don't have to. It's fine. No, Tyler, tell them. Closed mouths don't get fed. And I learned that really early. People sometimes are here and they're waiting and they're just like, what do you need me to do? And we sometimes just have so much pride, shame, or guilt that we stop ourselves from just being able to ask for help. I encourage you to lean into your hospital social worker. I will say this as well. They get busy. They sure do. Absolutely. Become their friend. Bother them a little bit. Take some time. If you got a half a day, go ahead and pull up on them and wait outside their office until they have a moment so they can see face. Again, connect that. Make them see that you're human and you love a human that is here that needs to be taken care of. I'm really big on reaching out to human services to access resources. I get it. I'm a social worker. I'm not a huge fan of people being in your business either. We already see how that has social work has actively affected communities of color, broken apart, and harmed communities of color. I also think they got some resources that we should put our hands in that a lot of us don't because of that fear from that historical oppression from the system. I recognize all those things are true. And so I do say they have some resources that I think we would be able to happily access. There's an organization out here called the Center for Trauma and Resilience. And if you need anything from rental assistance to rekeying your house to help with a new car, they will do anything and everything for you. And it's all assisted in this one space that's headed by this Black woman. And it's wonderful, right? Like, people know about things that we might not know in a Google. Lean into your accomplices and your allies. Lean into these white folks that have access. Hands down, it is what it is. And not just random white folks, right? The ones that you feel good with. The ones that are gonna take your voice and bring it into space, all right? Not just some random one that you think might be able to say something. There is something really powerful about somebody just cracking a door open, because as soon as the door is cracked, you can lean all up in there. And sometimes it's a person that tends to be white that has to be that door cracker, all right? Also, mutual aid programs. There are so many mutual aid programs out here that I don't think I've ever known about. And honestly, the only reason I know much about them now is because of my students at Smith always talking about mutual aid programs. And so there are literally programs out here that folks are just paying money to every month. And then when someone in the community needs some help, they just give some people some of that money from the pot, right? Some folks do this in their own individual communities. We're also seeing this at a larger level that is starting to get more capitalist to an extent, but more set up in a way for people to have higher access to it. Don't be afraid to ask questions, even the ones that sound stupid. Do it. Do it. Do it. What are they gonna say? No. Right? Find people that you can ask those questions to. But ask them, because if you don't know, you just don't know. And I think not knowing is one of the most uncomfortable spaces we tend to be in when we're navigating this work. Communicate your needs. All right. I need help. I need water. I need rest. But communicate it. Again, closed mouths do not get fed. And I know there is a level of discomfort, but I promise you that discomfort is far worse when you don't actively communicate what you need. Because people could just come in and give it to you, but instead you're just struggling because that's all you know, that's all you've seen, and that's all you assume you are worthy of having. And you're not. You are worthy of rest and ease and access. I also encourage you to have an outlet. You need clergy if that's your thing. You need a therapist if that's your thing. You need a spiritual advisor if that's your thing. You need a journal. You need something. You need something. There's no way that our human bodies are supposed to be able to hold on to all of this. No, absolutely not. Absolutely not. I know we assume such, but we also don't recognize and didn't see all the other things that were happening biologically, behaviorally, physiologically, spiritually to the people that we did see push through. And I think we have the ability to set a new precedent when it comes to the speed and the care that we take for ourselves as we are caring for others. All right. Next slide. That's it. Any questions?
That was fantastic.
That was fantastic.
Glad.
Fantastic.
It was you just kept bringing it back to don't be alone, ask for help. The system is kind of set up for you not to do that, and that all the things that we consider is wrong with us a lot of times has to do with the conditioning. And so thank you for that, because that's such a nice reminder, even to myself, who, I try to take care of myself, or try to, do all these things. But a lot of times I forget that the system is set up for me to fail.
Yeah. Yeah.
So thank you
True.
for that reminder.
Absolutely. Thank you.
Thank you.
I'm not sure if we have any questions on YouTube, but we have questions for you that we'd like to ask.
You
Lakeisha,
you want me to start?
Sure.
I working at a children's hospital. How would you work with, because I see it a lot. I see it a lot when, when people of color, families of color, Black people that I've worked with, families are dealing with, the white nurses who just do not understand them whatsoever. And then it creates this distrust of providers. And it feels, and it's horrible because of the fact that a lot of the times the parents feel powerless because these providers are pushing certain, treatments, and, the parents won't agree to that. And they ended up calling me. Well, these parents, they're difficult. They won't do this. We got to call Child Protective Services. And it just creates this whole distrust. Have you worked or been involved with any parents or families who are very bitter towards either the school? I've seen it in the school systems too, with this. And, what would be some of your recommendations to kind of work around that distrust?
Yeah. I think the biggest thing that comes up for me is two things can exist at the same time, right? Two things can be true at the same time. Like, this system can really suck. Like, it's bad and it's not set up for us to win. And also it's like the key to survival,
Right.
right? And so I think the biggest thing that comes up in this moment is taking time. So when I think of like a client I've had in the past, a lot of it was on my end as a social worker of being able to overemphasize like, this is bad. I get it.
Mm-hmm.
And I think sometimes people just need to pop that off. If I'm just being honest, I think people kind of just need to pop off the reality of what is actually happening right now. I also like to emphasize an advocate of some sort, right? So whether that be someone in the family that you're going to deem as the advocate, or finding someone within the hospital setting, or someone that you're able to bring in with you to assist you in some advocacy, and that could be through some resources through human services. But the biggest thing here is I need to know what's happening, and I need to tell you what I want. Right. And sometimes I think, again, thinking of historically of social work, if it's not in alignment with whiteness, then people are like, oh, no, this is bad. Oh, no, we got to get these people out of here. What's happening? What's happening? Yep. And that goes to a larger conversation around cultural competency for social workers in hospital settings in general. But I also think that there is a reality of the fact that if we have an advocate that is culturally understanding, then we are able to have them kind of assist us with like, this is what needs to happen. This is how it's going to happen. This is what's being requested. And that sometimes does have to be a family member. I've seen little 13-year-olds trying to be the advocate for the family due to language barriers, right? Yeah. But being able to just be like, honestly and truly, this is what we need. This is what's happening. This is what we're expecting. And knowing that, I don't like how I'm saying this, but this is kind of how it's coming up. Like, they don't have all the answers. I feel like they have all the answers, Sway, like that's not, they have it all. And so like understanding that there is a balance of like what they know versus what is true and what you feel like is culturally appropriate for how your family member is being treated. So yeah, advocates. Okay. Sometimes I just don't think that we have the capacity, the emotional capacity and bandwidth to be able to really have the conversation. But I can get somebody else, somebody else and have them help me out.
Okay. Thank you. Victor, did you have any questions?
I do. I was wondering if you could speak to if you saw a big difference. I'm sure you did, but I'd love to hear more detail. If you noticed a big shift in sort of mental health with BIPOC families, teens. We're still in the pandemic, but sort of in the throes, like, was there a difference, a shift? Did things get harder? And what did they look like?
Yeah. So I started my clinical practice prior to the pandemic. And then once the pandemic hit, I think there was a slight increase. For me, I wasn't accepting as many clients, but there was definitely an increased need for therapists at that time, especially therapists of color. You saw, like, we were seeing ads for therapyforblackgirls.com, and Taraji P. Henson created had some money in a foundation for Black men to get free mental health care. So it was definitely an increase once the pandemic hit. For me, I noticed a difference in conversation and topic in my clinical spaces. So the topics were transitioning into loneliness and connectivity and a lot of like, who am I type of stuff. And I think that was very interesting because it shows that a lot of us tend to define ourselves off of capitalistic views. And so if I don't have capitalism, then what do I have and who am I? I think those are some really interesting topics to have. And it also forced folks to be alone with themselves. And communities of color, we're known to hyper perform. We're known to go, go, go. We overperform sometimes because of stereotypes. And because like our parents told us that we had to work 10 times harder than white people, that thing that was just naturally ingrained into us. And so with like that fact of like how we just go, 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 and then all of a sudden we just sitting down, oh, the trauma is coming up. I have time to think about that one time my mama didn't do that thing. And I got time to think about how I didn't get hugged enough. And I got time to think about how my ex and this ex and that ex got all the same pattern behaviors. Like I now have time for these things to come up and process. And my brain is like, hey, and everybody was panicking a lot more during that part of the pandemic for sure.
Do you have another one, Lakeisha?
Thank you. Let's see. Sorry. Let's see. I didn't. Oh. Can you speak to the differences before and after COVID? That's probably a little similar to what you've just expressed. Like everything pretty much went up significantly. And especially during COVID, when kids went from going to school in person to going virtual. Have you seen an increase of, I don't know if it's behavioral issues or mental health issues skyrocket because of that switch?
Sure. No, I have not
Okay.
seen it personally. In regards to that piece, I have seen an increase in caretakers being stressed out.
Yeah.
That has absolutely shifted, right? So stress levels, we're seeing an increase in caretakers taking more medications.
Sure.
You're seeing an increase in, it was a big thing, and it's interesting because we like giggle about it, but and like, and it's so interesting because again, the systemic stuff, the systemic pieces to it, but you see those like TikTok videos and like social media videos of white women drinking bottles of wine in the middle of taking care of their kids, or you'll see marijuana being like a big piece now, and so like the parents taking smoke breaks in the backyard, and they tend to be white folks, right? And how like that was kind of normalized as like you need this to take care of your own kids thing, and how that like there was a difference in regards to like a lot of folks of color been doing this. We've been taking care of our kids and going to work and going to school. I didn't know I had an option to be drunk in the middle of the day while I did it. And also thinking about social services, like there's some interesting stuff happening. That's all I gotta say. And so there was definitely a transition in regards to caretakers, predominantly white women, having an increase in vices, increase in prescriptions, those types of things at that point, just to kind of ease the fact that I have to take care of these kids.
I've got one. So, see if I can get the words all right. If for us, we understand as BIPOC people that this is a pattern, and this is something that we've inherited from ancestors, and we're carrying these distresses. But how do you explain this to, let's say you're in an interracial marriage, or you are trying to explain this to a doctor who's white? How do you explain that this is where this is coming from, and that the blood pressure, the person's been eating, has become vegan and still has high blood pressure, or the person runs and exercises all the time and has really worked on losing weight and has lost the weight, but still has diabetes, or still has not actual diabetes, but pre-diabetic, let's say, right? So how do you explain this to our white people?
Totally. My brain is automatically saying we got to speak in their language in those moments. White folk love stats. They love numbers. They do not like personal experience because it didn't happen to them, so they don't care. Okay. But they love a number. They love a percentage. They love an article. They love a think piece. All right. And like, we just gotta be honest of like, what is really happening here? So if I can play that into my favor, that's how I'm gonna do it. And so whether that be, I am printing off an article, like I think about a friend of mine is pregnant, a Black woman, and she printed off a few articles when she came into her first hospital visit and was like, I just want you to understand, I am scared. And I'm scared because this article and this and these statistics, and I'm afraid of because of this. And I need you to tell me how you're going to assist me in like getting around this fear. And the doctor was like, oh, damn. Okay, well, right. And really had to be thorough in their communication, because I think also a thing is that a lot of folks just say like doctors just know it. So like we just have to take whatever they say, when honestly, no, you need to communicate this with me because this is my body and this is what's happening. And so that is automatically comes up. Bring in some stats, bring in some of those. They don't speak in experience and they don't speak in emotion. And I hate saying it, but it's just true. If you come in panicked and freaking out, as you can be, but if you come in any type of emotional, they are going to consider you erratic. They are going to consider you a problem. They are going to say, oh my goodness, you're just here trying to get drugs. They're going to say all kinds of wild stuff because we've seen it happen. And most likely we've experienced it ourselves in some way, shape, or form. And so I could set myself up in the best way possible. I'm going to come with this information and I'm going to say, hey, so the reason I have these concerns is because these are some things that I'm seeing. Can you talk to me a little bit about this? And like, let them do the work. That's not your work. You did the research already and you just bringing it to them. So tell me why this is happening if you're telling me I'm going to be okay. Right? It forces people to actually have to sit down, slow down, and explain. And I think that's a lot different.
That's great. Well, thank you so much.
I love that. That was great. That's the best answer ever. Statistics.
Stats.
Stats. Can't go wrong with stats.
You can't. Exactly.
Well, thank you so much. This has been so fantastic. Like I said, it's after 8, so we're gonna wrap up. Lakeisha, do you want to wrap us up?
Sure. So families, thank you for watching. Our guest Jaleesa was fantastic. For all our bright families, current or former, once bright parents, always bright parents, you're always welcome. We have support groups each week. Remember, you're never alone. It's not easy doing things on your own out there. Times are different these days and it's challenging out there. And you can definitely connect with any of our groups. As a bright parent, you can connect with our families daily, monthly, or weekly. We have a family support group, a Bright Family Support Group Facebook group. We also have a weekly parents supporting parents Zoom support groups. On Mondays, there's a BIPOC at 7 p.m. And on Tuesdays, is it parent to parent group, which is at 7 also. And
Father's group's at 7, and then there's a group at 9:30 for everyone.
And definitely you can, log on to our website, and we always have virtual speaker series live once a month with any interest that you may have. If there's anything that you guys want us to discuss or even have a speak upon or have a speaker to talk about, please let us know. And we will definitely, work that out. Again, I want to thank Jaleesa for the great information. And, definitely, Jaleesa, we will, provide your information if any other people or parents have any questions for you. And with that said, I want to thank you guys for watching tonight. And everybody just have a great and safe holiday and a great night. Thank you.
Thank you so much.